So my name is Amy Morgan, and I'm a neuropsychologist with the MGH Pediatric Epilepsy Program. And I'm going to be talking about some of the difficulties that are common for people with sunflower syndrome, particularly anxiety and executive functioning. So first, I'm going to talk very briefly about sunflower epilepsy and the effects on anxiety and executive functioning. And then with a little more elaboration, talk about defining anxiety and executive functioning for the purposes of this talk. And then finally, I think the most important part is how do we manage the difficulties? So first of all, having seizures can cause some disruption to development and our brain's ability to process information. This means that the abnormal electrical activity due to seizures can cause the brain to have difficulty forming the most effective connections between the billions of neurons in our brain. This type of disruption does not mean that the brain will necessarily have great difficulty at all, but just that the functioning is not as strong perhaps as it possibly can be. This aspect of brain functioning is referred to as executive functioning. Now, sunflower syndrome can also make people more vulnerable to anxiety. And it can be due in part to the unpredictability of seizures. And people with sunflower syndromes also have hand waving episodes that cannot be controlled, in addition to the stress due to others who don't understand that the seizures and hand waving episodes are not under your control. So a good first step to reduce the vulnerability to anxiety and to executive functioning difficulties is first to understand what these are. So for the purposes of this talk, anxiety is worry about the future or what will happen. Significant anxiety or a little nervousness is normal, and most people experience when doing things like speaking in public or taking a difficult test or really doing anything new for the first time. When anxiety increases, it can be experienced as fear, restless, or irritability. Sometimes children develop headaches or stomach aches, their palms become sweaty, or they feel like their heart is racing. Anxiety occurs when the fight or flight part of our nervous system, referred to as the sympathetic part of the central nervous system, becomes more active and much stronger than the rest and relax part of our system. The reason for this difference is often due in large part to epilepsy. Seizures, just the nature of seizures, can activate an anxiety response in our brain, and over time that response becomes stronger. It's like a muscle that builds up and becomes stronger and stronger. In the meantime, the rest and relax muscle has not been tended to as much and so becomes weaker, and anxiety can become a prominent or predominant response. When we are more highly anxious, our cognitive or thinking skills often include, or the tendencies often then include the tendency to be excessively vigilant. Hypervigilance often causes a narrowing of focus, the tendency toward cognitive rigidity, which means difficulty shifting attention or incorporating feedback from others, and the tendency to miss the big picture or main point of situations. As we are busy scanning or attending to the environment for possible threats, which will in turn affect our ability to think clearly and cause academic performance, for example, or our social relationships to potentially suffer. It's often difficult for a child, or any of us for that matter, to identify or put into words what they're feeling and why. But whether we realize it or not, when we are anxious, we have difficulty focusing on what we're doing. Anxiety interferes with our ability to do well and adversely affects our executive functioning. Now, it isn't necessary to experience anxiety to have executive functioning difficulties, but anxiety will certainly create or add to the difficulties. So, what are executive functionings? Um, Basically, it's the brain's ability to run the show, or they're often referred to the CEO or chief executive officer of our brain, meaning that we can be very smart and have well developed skills, but have difficulty using our knowledge and skills effectively. So, the executive functioning helps us to manage time, pay attention, and switch focus, plan, organize, remember details, and do things based on our experience. Executive functioning occurs, or the development of executive functioning occurs over a long phase of development. And in fact, the development of these skills can continue well into our 20s. As a result, these skills are also vulnerable to disruption from a variety of factors that can include epilepsy, anxiety, and a variety of social and learning experiences and other medical conditions. So, executive functioning consists of many discrete skills, but there are three basic functions that I'm going to review now. The first is inhibition. So, it's the ability to ignore distractions, resist temptations, think first before acting. This skill allows us to think through and process information before acting on it. A child who struggles with this skill will often react before thinking through a problem. They may often say inappropriate things before thinking if they should say that or not, or do something or not, or they may engage in some risky or just silly behaviors. The next important executive functioning is working memory, which is the ability to hold information in mind while doing something, such as remember the instructions while carrying them out, being able to solve math problems, for example, in our head, or being able to follow a conversation and remember who said what, or to read a story and then answer questions about that story. And finally, there's cognitive flexibility, which is the ability to shift our focus from one thing to the next, or to be able to think of multiple ways of doing something. Imagine something unexpected comes up while you're doing homework or when you're in a social situation. Cognitive flexibility allows us to consider what the options are for dealing with this unexpected event, manage a potentially awkward situation, or complete your homework on time. In sum, the flexibility helps us look for and then consider possible alternative solutions to work the most effectively for the best outcomes. In sum, executive functions are necessary for complex actions, mostly when situations are new and unfamiliar, and when you have to think about what you're doing. So imagine that you drive a familiar route home in your car each day from work, and you get home without even recalling how you got there. There was absolutely no need for executive functions during this familiar trip. However, should something new or unexpected happen along the way next time, you would have needed, or you will need to act quickly to take in the new information and adjust your approach accordingly. That's when executive functioning is vital. So basically, executive functioning or cognitive control is needed when going on automatic does not provide the best outcome. And intact executive functionings are necessary for us to use voluntary control of our thought and actions. So the combination of the three aspects, the three primary aspects of executive functioning, allows us to formulate plans, adapt to changing circumstances, engage in more complex reasoning and complex concept formation as developmentally appropriate. Do things such as understand complex literature when we're in school, or solve complex math problems, and manage complex or emotionally laden social situations. Children who struggle with executive functionings may have problems with things such as planning projects, estimating how long it will take to complete a project, telling stories either verbally or written with appropriate beginning, middle, and ending points, starting activities or tasks or initiating activities, and memorizing and then recalling the information when appropriate. So we kind of know what these things are now, but what do we do about the difficulties with anxiety and executive functioning? So managing anxiety, some key points are often the first step is to help your child understand when they're anxious. Understanding and being able to name what they are feeling takes some of the power away from anxiety, and the feelings then become less overwhelming. Provide your child with a concrete way to understand anxiety, such as explaining that fight or flight response and ways they can build up their rest and relax muscle. Be aware of the times in which your child is most comfortable talking about sensitive issues. And then with your child, think together about activities or even ways to talk about um, their anxious feelings or just their uncomfortable feelings. They don't have to be labeled as anxiety, and how they can strengthen their rest and relax muscle. Strategies that have been shown to promote relaxation include deep breathing, mindfulness, yoga, some forms of martial arts such as karate or taekwondo. Favorite activities might include things such as doing exercise, drawing or painting, writing in a journal, watching a favorite film, or talking to friends. Just any activity that can be relaxation and also direct attention away from the anxiety. When anxiety begins to interfere with sleep, learning, social interactions, and or self-confidence, it's often best to work with a therapist who specializes in treating children or young adults with anxiety. A therapist who practices cognitive behavioral therapy, CBT, or dialectical behavioral therapy, DBT, are usually the best because they have the training and expertise in this area. And the use of these sorts of therapies has also been shown through research to be the most effective. So these forms of therapy help your child, as developmentally appropriate, develop awareness and control over their own responses to anxiety, use relaxation techniques to help manage the symptoms of anxiety, and then they help your child identify and replace any self-critical beliefs with more adaptive beliefs and thinking skills. So managing anxiety in the classroom can be challenging as well. And so some ideas are having one person or a point person, could be a teacher, the school psychologist, or even just the individual with whom the child feels most comfortable talking. This person can be calming and an empathetic presence and help your child develop and use coping strategies. If your child is seeing a therapist outside of school, it's often best for this point person to collaborate or coordinate approaches with that therapist. Encourage self-awareness for the entire class. Have the teacher talk about stress and anxiety, given that most students, in fact, probably every student experiences these symptoms to one degree or another, so that all students can learn to recognize their symptoms and then build empathy for those who also are experiencing anxiety. Teach time management. Organization strengthens the feelings of being in control, which is critical for a child who is anxious. And by the way, for a child who's having executive functioning difficulties. Some examples include providing flexible due dates for tasks. So perhaps packets of information can be turned in at various times, which is kind of like dividing larger tasks into smaller points to support time management and help the student feel more in control of the workload. When appropriate, giving A's or extra points for effort to encourage perseverance and some good or healthy risk taking, like raising their hand to answer a question or offer a solution, which can be particularly difficult for anxious students. So as I said, anxiety rolls over and causes executive functioning difficulties, although it might not be the only reason that a child has executive functioning difficulties. So now I'm going to go through some areas of executive functioning and give some ideas for helping control these difficulties, which can be used at home and school as appropriate. So strategies for impulse control, the child should have very clear, enforceable expectations at home and in the classroom. So it's very clear to them, and sometimes with visual supports, what their boundaries are. Have predictable consequences for those expectations or rules when they're not followed. And they don't even have to be punitive, but just there's a consequence for their behaviors. As I had just said, use visual reminders when appropriate, which can be very helpful, especially for children who have working memory difficulties. And so they have difficulty holding in mind the rules for behavior in the classroom. Encourage appropriate behavior by modeling, and also before inappropriate behaviors get out of hand. So gentle reminders for appropriate behaviors can be very helpful. Give heads up before transition. So give, for example, a 5-minute and then a 2-minute warning before a transition to a new activity or new setting. And for children whose impulsiveness leads them to become more out of control, anticipate the potential explosive situations and explain ahead of time what will happen, what's going on, which will help a child feel more settled, as they won't be caught off guard. And this is also very helpful for children who are anxious. Working memory, some ideas include have your child teach you what might be a new concept or activity. The practice of explaining a skill or activity helps them to remember all of the steps needed to complete the task, and also helps them understand the task better. Work on visualization skills. For example, have your child create a visual picture in their head of what they just heard. Or if you've read a story, have the child visualize the story in his or her head as they read it, and you can model for them with words how that might go. This works best in a classroom because teachers, for the most part, are trained how to do this, and they're also teaching methods that can be used by a school or purchased by a school. One of them is called Linda Mood Bell's Visualization and Verbalization program. Play card games that use visual memory, or just games that use visual memory. Play card games such as Crazy Eights, Uno, Go Fish, etc., that have a child rely more on working memory. And by the way, these activities should be fun for your child and not be seen as more homework or another thing they just have to learn. You can kind of trick them into developing skills without having them know they're actually doing something that might be productive, which isn't as much fun. And practice active reading strategies when appropriate, such as how to take notes, how to use sticky notes, asking questions as they are reading, etc. Again, that can be undertaken at home, probably best undertaken in the classroom. And cognitive flexibility. You can play What's This? Show your child an ordinary object and see how many things they can imagine it is, or how many different ways it can be used. Teach self-talk at school, talking through a scenario, thinking out loud while problem solving. So modeling your flexible thinking process for the child. Find more ways than one to do activities, games, etc. Model by using self-talk. Again, as I had mentioned, talk through a scenario. Think out loud while problem solving. On writing tasks, model brainstorming ways to come up with new ideas. Um, Written expression or thesis writing as age and grade appropriate can be a great way to build executive functioning skills. And often speech language therapists can be used because they are trained how to do this, how to organize writing, and also how to develop executive functioning. And strategies for organization can include keeping a family, classroom, or just the individual student calendar, introduce checklists, and they can be creative and fun checklists, in addition to actually getting more difficult things done. Get ready for something the night before, and again, helping your child or the student by modeling for them how you would do this, laying out clothes, getting a backpack ready for school the next day. Use containers and desks or closet organizers, and work with the child, often with verbally mediating how you're thinking through how to organize or make use of these organizers. Establish homework routines and classroom routines that are easy for the child to follow, and then building on those. You could assign tasks or chores that include sorting and organizing items. And again, I want to emphasize that, especially at home, these sorts of things should be as fun as possible too. And clean out the clutter. Um, those of us who have organization difficulties find it much easier to think when there isn't a lot of clutter that can mess up even our thinking processes, even though it's just physical clutter. And then there's task initiation that can be extremely difficult for kids with executive functioning difficulties, and also for kids who are anxious because they're afraid of failure. So using a timer, visual timers can work really well, because then your child can also see time as it's passing. And if there's 10 minutes to work on a task, for kids, especially with executive functioning difficulties, that 10 minutes can seem, you might as well say it's going to take all night. But when they see the time pass and see the beginning and the ending of the time passing, it can be very helpful. Make a goal journal if appropriate. Break down a task into mini steps or actions, particularly if anxiety is involved, because then the task isn't as open-ended and there's a clear ending point, and the child can get a kind of a boost of energy as a reward as they finish the task, and helps kids who also happen to be perfectionistic because there's not something open-ended for them to do. Have specific times each day or a time slot schedule, it can be referred to, for specific tasks such as homework, so that their brain is ready to get into the set of performing the task at a particular time each day. Eliminate distractions, both auditory and visual, as much as possible, and use breathing exercises like belly breathing and self-talk. Again, it has to be modeled initially for the student, which is particularly good for children with anxiety and or executive functioning difficulties. These strategies are not a one size fits all, and it depends on what's going on with the student and the child. It depends on their age and developmental level, and it depends on their particular constellation of difficulties. But I think the important thing to remember is that, without a doubt, weaknesses can be effectively addressed. The brain is remarkably plastic, and those billions of neurons I was talking about, they are forming new connections all the time. And the more these more effective processes are put in place to address anxiety and executive functioning, the easier it is for the brain or the child to eventually use them as the brain becomes wired in a different way over time, and the more successful they will feel. And your child will make developmental progress. Thank you very much. And if there are any questions, I can be available to answer them.